So today, Donald Trump posted this on his Truth Social, and we have here the Blaze posted this morning. It is very important that the drug companies justify the success of their various COVID drugs. Many people think they are a miracle that saved millions of lives. Others disagree. With CDC being ripped apart over this question, I want the answer, and I want it now. I have been shown information from Pfizer and others that is extraordinary, but they never seem to show those results to the public. Why not? They go off to the next hunt and let everyone rip themselves apart, including Bobby Kennedy Jr. and CDC, trying to figure out the success or failure of the drug company's COVID work. They show me great numbers and results, but they don't seem to be showing them to many others. I want them to show them now to CDC and the public and clear up this mess one way or the other. I hope Operation Warp Speed was as brilliant as many say it was. If not, we all want to know about it and why. Thank you for your attention to this very important matter, President DJT. So I saw that this morning and I was like, wow, because, you know, hasn't seemed to be very vocal about this, which has been concerning, especially for those who are advocating for the COVID vaccine to be completely removed.
Right.
There has been some work done with this as far as Bobby Kennedy taking it off of the mandatory. You know, it's no longer mandatory, but it's still recommended, especially for kids. Which why, you know, and they're not really talking about the vaccine injured, and a lot of people are suffering, and a lot of people are being silenced and being ridiculed, and just more of the same. And I get it. There are people out there that are anti-vax in general, and I do think that we need a lot more. There have been studies that support it, and there have been studies that don't, and it's a whole thing. I'm not that educated on it. I just have read a few things, but I thought that this was a really good sign that he is like, I'm listening, you know, because I really believe that he believed that the Operation Warp Speed was just this brilliant, amazing thing, that they were able to pull it off. I think that it's just me and my 2 cents, which isn't worth much, but I think that he was lied to. I think that he was, you know, didn't have people around him that were trustworthy at the time. And I think that this was something that was already in the works and already wanting to be pushed. And I think that that's why it was so quick.
Yeah. I think this is a good post by him.
Absolutely.
Because he's doing two things, in my opinion.
Okay.
Because you can see he's been told. He said he's been told and showed that, oh, it's done so, you know, the results are so good. You know, everything's great. Everything's good. Results were good, blah, 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 blah. But then he's also, in the very first sentence, he says that the drug companies should justify their success. And I think he wants the proof. He wants everything to come out into the light. And I do believe, like what you were saying, I think he had been lied to. Now he's got a stronger support staff, and there's a lot of people that are looking back now saying this vaccination was not what it was hyped up to be, that it may have been rushed too fast. There was nowhere near enough tests done.
No.
And we are seeing more and more reports of the negative.
We were the
side
test,
effects.
in my opinion.
Yeah.
I think this was a science experiment, some weird twisted, I mean, whatever, paint me as a conspiracy theorist. I don't really care. I believe that this was by design, and I believe, I mean, I don't care. You know, I believe that there is something going on, something sinister going on. I'm not saying everyone is implicated. I'm not saying everyone involved is implicated.
Yeah.
I think there were a lot of people that trusted the science, so to say. They trusted the system. They trusted you know,
Yeah.
I mean, it was very eye opening for everyone. And so after that post, this has been, talked about a lot today online, and it's been a topic of discussion. And so I've come across a few other things. This next post by Nicholas Hulsher says, this was yesterday. Breaking, state begins declaring public health emergencies over soaring infant deaths linked to transgenerational mRNA vaccine fatal adverse effects. CDC data shows babies born are now dying at a 77% excess rate. Years after mass vaccination of childbearing women, the 30-year decline in infant mortality collapsed in 2021. Immediately following the mRNA injection campaign, excess infant death causes mirror those observed in vaccinated adults, suggesting transfer of mRNA vaccine genetic material to offspring.
Wow.
A transgenerational crisis is here. Children are dying who were never injected, but whose mothers were.
Meaning that the adverse effects are being transferred to the children that were not even born yet.
Because that's one thing I don't think people understand about this mRNA vaccine. It changes your DNA. That is just like Orwellian. I mean, it's not, I don't know. No, thank you.
No.
I don't want that.
No, I don't either. He posted this little video. It's just short, but it's good to watch. It's just some more information about the children.
CDC child death records indicate catastrophic transgenerational harm of mass mRNA vaccination programs. A new analysis of CDC data by Ethical Skeptic shows children born following mass mRNA vaccination of mothers are dying at a 77% excess rate. That's nearly 18,000 additional deaths in ages 0 to 4 since 2021.
Jeez.
The CDC's own death certificate records reveal an inflection point after 30 years of steady decline in infant and child mortality. The curve suddenly reversed in 2021. So two distinct signals emerge. Teratogenic effects, so rising deaths among infants exposed in utero. But the most concerning is transgenerational effects, sustained excess mortality rates seen in children who were never infected, never injected, but whose parents previously were. The excess deaths span multiple systems: cardiopulmonary, renal, neurological, congenital, septic causes, the very same disruptions observed in injected adults. These findings are not speculative models. They come straight from the government's records. If confirmed, this represents a public health crisis of historic magnitude, one affecting not those who were injected, but their children, grandchildren, and generations yet to be born.
So that's horrifying.
Yeah.
Another quick clip here is from a news clip talking about it too.
Literal war zone.
Let me back up.
Shocking health crisis is generating comparisons between one state and a literal war zone. Mississippi has declared a public health emergency
Just not a very loud video.
Mortality rate, which is, get this, even higher than that of war-torn Ukraine. And it has people asking why so many babies are dying in Mississippi and what can be done to save them. News Nation's Xavier Walton has the details. I mean, Xavier, how is this even possible in 2025? What's happening in Mississippi?
Marky, that's a great question. And honestly, that's what health experts there are trying to figure out. Ultimately, this is a tough topic that hits close to home for you and also new and expecting mothers across the country. Should mention, the U.S. has made great progress over the past 40 years, but that's as a nation as a whole, cutting the infant mortality rate nearly in half from 10.9% in 1983 down to 5.6 in 2023, the most recent year data available. But that success isn't the same across all 50 states. In fact, 20 states saw more than 6 infants die out of every 1,000 born. That's higher than the national average, and infant deaths have gotten so bad in Mississippi in particular. The state declared an infant mortality rate public emergency. According to the state's health department.
Yeah, look at that graph. I'm going to pause it for a minute. Look at that graph. This is 2020. There's 2020. You can see from 2016 it was going down to 2020, 2022, which of course they didn't do anything in 21. But that's back when they was pushing the jab. Then all of a sudden in 2022 it jumps up to 9.2. 8.9. It bounced back a little bit, but now in 2024, 9.7. That's horrible.
Deaths per 1,000 live births last year. It's the highest infant mortality rate in more than a decade. And what's the most staggering, the infant mortality rate for Black children in Mississippi up to 15.2, nearly 3 points higher than the year before, and it's the highest level in years. For other non-Hispanic children of color, the infant mortality rate better, but still, more than double the national average at 12.3 infant deaths per 1,000 live births. It's at 6.3 for Hispanic children, and nearly in line with the national average for white infants at 5.8. Put it simply, Marky, more than 3,500 infants have died in Mississippi before their first birthday in 2014. Think about that number, more than 3,500 before their first birthday since 2014. That's why so many are just trying to get to the bottom of this growing crisis.
Yeah, impossible to even.
And that's since 2014. So that is really, really weird. So what is going on in Mississippi?
Yeah.
So I saw that. So basically, this was already a post, and then the post that I just read, and then we watched his video, was adding to this.
Yeah.
So I'm not exactly sure. I just was like, well, we can show this clip too.
Yeah.
I'm not exactly sure when that was made or
Right.
Let's see. Well,
it was posted in 24, and it does
it
not,
was post,
and it
no,
does
where
not
does it go? No, it wasn't.
look up here.
That's his name.
It was
August. It was yesterday.
But that was when he posted, not when the video was done.
Right.
Yeah.
So I don't know. Apparently there is a crisis going on with infant mortality rates and children dying between,
Before the
under
first
the
birthday,
age of 1. I mean,
Yeah.
is infants up to age 4.
Yeah. Now, just to be clear, this did not say that it's caused due to the vaccinations or anything like that.
No,
But
it's just another.
It does show a change in the graph where we were on a trajectory where the infant deaths were going down. Now after 2021, it's went back up.
Right.
So you could correlate how you want.
Well, and like hopefully they're testing
Right.
these things.
Yeah.
Because I don't think that would be very hard. I mean, to at least to say, well, out of all the deaths, how many of them,
Yeah.
have this medical history? Okay. Or the mother has this medical history.
Yeah.
Where she was vaccinated. Or the child was.
Yeah.
But anyway, I saw that and I thought I didn't know about that. And I didn't know I knew that there were, vaccine injuries. I knew that people were having myocarditis. And I even heard that, there has been talk about cancer patients having exacerbated symptoms. And so I've heard of those kinds of things happening with people. And then young, healthy people, no history of heart issues, and then all of a sudden now they have a heart problem. Now they have myocarditis, or they have a heart condition, and that's becoming more and more prevalent. More and more people are connecting the dots, and it just all goes back to it not being tested properly, it just being pushed through because of this emergency that links back to how it was, you know, how this all happened. And it just makes you, it's hard not to, to wonder. And then the ones that did take the vaccine, and I don't know. I just think that I don't know. I think there's going to be people that probably are going to deny it. They just are going to deny it. Doesn't matter how much proof. And then I think that there are going to be those that are going to be really upset, as they should be. Yeah. But ultimately what matters is the truth. We need to know.
We need to know.
So I'm glad that Trump made that post. And also saw this too, that I didn't know who this person was. This, what's his name? Dimitri. That doesn't have his name on there.
I don't have his name on here.
Yeah, there's his.
Yeah.
Dr. Dimitri Daskalakis. I probably butchered that. I'm sorry. I had not heard of him before, had never seen him before, but apparently he is the former director of. Go back up.
Yeah, right there. He's the former director of the National Center for Immunization and Respiratory Disease.
Okay. Of the CDC.
Of the CDC.
So he was the one who was over immunizations. Okay. I don't know how long he was there. Maybe we should look that up. But
I think he was there, started with the Biden administration.
So he resigned on the 28th, which is just a few days ago. So lots been going on just in the last few days. Yeah. Basically he didn't see eye to eye with RFK Jr. He was not on board with his agenda.
Ideological views
clashing ideological views, which I would 100%. Yeah. Because if you are okay with all of this, then it's just not going to work. And so he resigned. But since then, people have been talking about it, and they've been showing these questionable pictures of him and how, this is the guy that, you know, and it's like, okay, so you're gay, big deal. But why are you into all this satanic stuff? And why are you like flashy about it and like flaunting it? Like, look at me. I'm just this strange man that is into dark stuff, and I'm not afraid to put it out there.
This is not the type of person
disturbing.
You want to be making. This is not the type of person you want to be making decisions over the well-being of your family.
Right. And like what the, what the CDC guidelines are for immunization schedules for infants and your children, and public health, it's just, what's going on, So, just strange. It's like, I don't know. I don't get it. But apparently, he is gone now. He's resigned. So, and then, I was also reading about RFK Jr. firing a lady.
The director.
Yes, that's her. That's it right there.
Right there.
Yes, her. Wait, let's see. mRNA is perfectly safe for your kids. That's what she was saying. That was CDC Director Susan Menares. Probably didn't say that right either. Who was fired today after just 4 weeks on the job. So this was the 27th. So this was last Wednesday. So all this is happening, right?
Yeah.
So RFK fires her. Then the next day, this Dimitri man, he resigns. And then today, Donald Trump posts this.
Yeah. Well,
so
and you
it's
read
just
this.
interesting.
You read this. It says, and she was fired less than 24 hours after Bill Gates met with President Trump.
I don't know if that makes me feel better about it.
Yeah, I don't either. I don't know that I trust Bill Gates. He's
no. No. Click on that. Show more. Just curious about that.
No, just talking about the other people that
have resigned. So he fired her, and then 3 people have resigned since. So things are happening. I know that online there have been a lot of people talking about how they're upset that not more has been done within the CDC, within the NIH, within HHS with RFK Jr., how he has been doing some things, but you can kind of tell that he's kind of limited, and it looks like it's just a cleaning house kind of a situation where you have people that are, you got to think I can't imagine how many, I'm sure you could look it up, how many employees that they have, but I'm sure it's very, very many. And so, it's kind of like finding who needs to go.
Yeah. Oh, this is something else right here now.
Oh, that's Callie Means.
I don't know how legit this is.
Fox
but,
News.
Well, just the guy's chief nerd. He said there's a memo going around the CDC and throughout HHS about how to subvert President Trump and how to subvert Secretary Kennedy. They are saying we are going to outlast them.
Oh, I wouldn't be surprised.
Yeah.
You can hit. I guess it is playing.
Yeah, let me back up.
It's kind of remarkable, Callie, to watch these people walk out of the CDC in protest, but you can't help but think it's probably all for the better.
There are really high stakes here, Charlie. I mean, my wife is 8 months pregnant. My sister is 7 months pregnant. This is a miraculous process. I mean, watching them grow human life inside their womb. This is a sacred process. This is a process that at the highest level of science we should be celebrating. And there is one type of person who can undergo that process. That is a woman, and that is a mother. And this man who they are celebrating right here, and that is being held up by the media as the paragon of science, does not have the moral or scientific rigor to speak the word mother. Today, President Trump and Secretary Kennedy are the two most popular public officials in America. And I think it's because they put on armor every single day and go to work to fight for science and to fight for kids. Under the CDC, we have had guidelines on COVID for 2 years of school lockdowns. It turned out those guidelines were written by the teachers' unions. We have the CDC website to this day celebrating smaller family size and actually alluding to abortion as one of the great public health advancements in modern history. We have the CDC, it's recently come
reading
out,
about that
actually
too.
hid research on myocarditis risk for the COVID vaccine for young boys. And actually, when you get past the rhetoric and actually look at why these people are resigning, look what they're listing that Bobby Kennedy did, it's that he took the COVID vaccine off the recommended schedule for children. 95% of parents were already rejecting that advice, and actually 85% of healthcare workers were rejecting that advice. So
That's
when
good to
these
know.
people in the media say that they are standing up for science, they are saying they're going against 95% of parents, and they want every single 6-month-old in this country to have a mandated mRNA COVID injection.
It's disgusting.
I want everyone watching to know this. There is a memo going around at the CDC and throughout HHS about how to subvert President Trump and how to subvert Secretary Kennedy. They are saying we're going to outlast them, that the Republicans are going to lose the midterms, that this is going to be a flash in the pan. The American people have a very, very clear choice. Do you accept their argument that the status quo when it comes to healthcare in this country is acceptable, or do you support President Trump and Bobby Kennedy who are fighting for reform?
Callie Means, a great warning. Thank you very much.
So here's what just really irks me is that this should not be political. This should not be Democrat, Republican. This should not be left versus right. This is like people's lives and their health. And you're an institution that has been trusted. And that comes with great responsibility.
Yeah.
And first of all, it is not a bad thing to be skeptical about your own health and your own wellness and the health and wellness of your children. It is not bad, wrong. You should not be shamed if you ask questions because you want to make sure that it's the best thing for you and your body and your health and your children.
Yeah.
And the level of shame and disgust from certain people and sides about just that simple thing, it's just really bad, and it's gross, and I don't understand it.
Yeah.
Because I don't understand why you should hate someone or cast hate onto someone or act so ugly to someone you know or don't know because of their choices and because they just aren't comfortable with something.
Mm-hmm.
And that's one thing about COVID and the COVID vaccine and how it really divided us as a country. And we haven't recovered from that. And that's something else on top of all the other that was really devastating for us as a country, and really devastating to families and friends, and more so than politics. Because politics, yeah, you're going to argue, you're not always going to get along, but it's just politics. That's like something that's, it's part of the culture. It's just part of the way it is. But this was different, because this is like, people are dying. People are being lied to. Medical data was, faulty. And I mean, there's just so many. And I know that there's some people that are going to say, oh, she's crazy. She's making it up. She's a liar. I don't really care. I just know that there are people that trusted, they thought they were doing the right thing.
Mm-hmm.
And that is evil.
Yeah, it is.
To take advantage of someone who was doing what they were told and they thought they could trust, and the system, and these things are happening. And I don't like it. And it's upsetting.
Yeah. Yeah, it is.
So,
well, I'm going to be interested to see what comes about this. If CDC releases any more data, I don't know. I mean, I don't even know if you, at this point, can you even trust them?
I think so.
Knowing the people, majority of the people who work there, I don't even know if they're even trustworthy.
I think that what's going to have to happen now is what should have happened. What we should have a higher standard of just transparency, accountability. It just needs to be, there needs to be evidence that's provided that, these studies need to be, there needs to be evidence-based information for the public. And it needs to be open and honest and say, look, this is what we've studied. This is what we've found has been going on. And, we need to be able to trust. We need to build the trust back in our country. I mean, that in itself, and it's not just through the CDC. It's not just through, but it all across the board, because it's causing so much harm.
Yeah.
I think.
I agree.
So, and back to the infant mortality, which is just devastating. We're also hearing about infertility rates. So it's just a lot, it's just a lot. Like, you're hearing that infertility rates are up, and now infant mortality rates are up. And God help us, Yeah. So, yeah. Sorry. A little emotional.
Yeah.
It's just an emotional topic, and I think it's okay. I think it's okay to care.
Oh, yeah, it is. It is okay to care, and it is okay to get emotional when you're talking about children, the innocent.
Well, and about people who want to have a family, and how devastating. So I hope that we can come together as a people.
Yeah.
And demand more from those in positions where they're given this level of respect and you know, let them earn our trust back.
Mm-hmm.
I think it's okay.
Yeah.
You know? Also, I just have to say how strange that video.
Mm-hmm. Yeah.
The one that just now.
Yeah.
Or I guess he was leaving. That was when he had resigned, and they were
so happy for him. That
I mean,
he
they were
left
just, well, it was like a celebrating him kind of thing. And there's flowers everywhere, and they're laying flowers down like it was some kind of a vigil or some kind of, I'm just like, what is wrong with people? So weird.
There's a lot of crazy people out there.
Well, the fawning over people is just so bizarre to me. I'm just like, what? I don't get it.
I don't either.
And part of me wonders, is it real? Is this all staged? There's so, you know, you just wonder like how much is genuine,
there's a lot of crazy people out there, and there's a lot of crazy people that just want to be a part of something.
That's true.
And
they want to belong.
And they think that them showing support for this person who is stepping down, who, you know, is a good thing. Whatever. See ya. I'm glad you're gone.
Yeah.
You don't need you're not the type of person. You don't have the moral values that should be making decisions on
about public health
and what families should be getting or doing.
No. And I think too, it's like,
I'm not even talking about the gay part, his satanic, after hours, activities.
And it's like, keep that stuff private. I just don't like the flaunting of it. I think it's just very weird. But you know, when people show you who they are, believe them.
Yep, that's right.
You know, ultimately that is
they've
the
gotten
takeaway.
so bold that they tell you.
Well,
they
they're proud
tell
of
you
it.
to their face.
Mm. So, but I just thought that was very, very strange and something I just noticed there. And I was going to say something. I can't remember now, but we've probably been going long enough. So
yeah, I'm starting to
we probably need to let you guys go. And if you're still watching, thank you. Thank you for watching.
Echo and feedback. You didn't hear it?
I didn't.
No, it's okay.
I was probably talking too much. Yeah. I didn't hear it. But anyway, thank you for watching.
Yes.
We'll see you next time.
Thank you for watching. And if you haven't already, please like, share, and subscribe, and help us grow.
Yes.
We haven't been putting out a lot of videos lately, but we're going to try to get back on the ball and start putting out more content more frequently and all.
At least weekly.
But anyway, we appreciate you. Thank you. And until next time, we'll see y'all.
Bye.